Welcome back to Graceful Years, where we talk honestly about the realities of aging with dignity, health, and practical wisdom. Today's topic might seem basic, but it's actually one of the most important conversations we can have about maintaining health and independence as we age. We're going to discuss 3 specific areas of your body that require daily attention, especially after age 70, and why this simple daily care can make the difference between thriving independently and facing serious health complications. This isn't about vanity or superficial cleanliness. This is about preventing infections, maintaining your dignity, preserving your independence, and quite literally protecting your life. The 3 body parts we'll discuss today are areas where age-related changes make daily cleaning not just important, but absolutely critical for your health and well-being. As we age, our bodies change in ways that can increase our risk of infection, skin breakdown, and other serious health issues. Our skin becomes thinner and more fragile. Our immune systems may not respond as quickly to threats. Our mobility might be limited, making thorough cleaning more challenging. Some medications can affect our body's natural protective mechanisms. But here's the empowering truth. With knowledge and consistent daily care, you can prevent most of the serious complications associated with poor hygiene in these critical areas. You can maintain your health, your dignity, and your independence well into your 80s, 90s, and beyond. The 3 body parts we'll focus on today are your feet, your genital and anal areas, and your mouth. Each of these areas presents unique challenges and risks as we age, and each requires specific, daily attention to prevent complications that could seriously impact your quality of life. Let's dive into why these areas are so critical and exactly how to care for them properly. Body Part 1. Your feet. The first critical area that demands daily attention is your feet. If you're thinking, I wash my feet when I shower, I want you to stay with me, because there's so much more to foot care than a quick rinse with soap and water. Your feet are remarkable. They've carried you through decades of life, millions of steps, countless adventures. But as we age, our feet face unique challenges that make them vulnerable to serious, even life-threatening complications. Let's start with what happens to feet as we age. The skin on your feet becomes thinner and less elastic. The fat pads on the bottom of your feet, which have cushioned your steps for decades, begin to thin out. Your circulation may not be as robust as it once was, meaning your feet receive less blood flow, less oxygen, and fewer infection-fighting white blood cells. If you have diabetes, these changes become even more critical. Diabetes can cause nerve damage, called neuropathy, which means you might not feel cuts, blisters, or sores on your feet. Diabetes also affects circulation and your body's ability to heal wounds. What might be a minor scrape for a younger person can become a serious, slow-healing wound for someone with diabetes. But even if you don't have diabetes, foot problems can seriously impact your mobility, independence, and quality of life. Untreated foot issues can lead to infections, falls, and the inability to walk comfortably. Here's your daily foot care routine. Daily inspection. Every single day, examine your feet thoroughly. Look at the tops, bottoms, between your toes, around your heels. You're looking for cuts, scrapes, blisters, redness, swelling, or any changes from the previous day. If you have trouble seeing the bottoms of your feet, use a mirror or ask a family member to help. Pay special attention to areas where shoes might rub, between your toes where moisture can get trapped, and around your toenails. Look for any discoloration, unusual growths, or areas that look different from usual. Daily washing. Wash your feet every day with warm, not hot, water and mild soap. Hot water can burn skin that may have reduced sensation, and it can also dry out your skin excessively. Use your hands or a soft washcloth to gently clean all surfaces of your feet. Pay special attention to between your toes. This is where bacteria and fungi love to grow because it's warm, moist, and often overlooked. Gently separate each toe and clean the spaces between them. Thorough drying. This step is crucial and often overlooked. After washing, dry your feet completely, paying special attention to between your toes. Moisture trapped between toes can lead to fungal infections like athlete's foot, which can be particularly problematic for older adults. Pat your feet dry rather than rubbing vigorously, which could irritate thin skin. Make sure every area is completely dry before putting on socks or shoes. Daily moisturizing. Apply a good quality foot cream or lotion to your feet daily, but avoid putting moisturizer between your toes, where extra moisture could promote fungal growth. Focus on the tops and bottoms of your feet, your heels, and around your ankles. Look for moisturizers that contain urea or lactic acid, which are particularly good for dry, thickened skin that often develops on feet as we age. Nail care. Keep your toenails trimmed straight across, not curved, to prevent ingrown nails. If you have trouble reaching your feet or seeing clearly, don't hesitate to ask for help or see a podiatrist regularly for nail care. Proper footwear. Wear shoes that fit properly and provide good support. Avoid walking barefoot, even indoors, where you might step on something sharp or stub your toe without realizing it immediately. Check inside your shoes every day before putting them on to make sure there are no objects, rough seams, or other potential problems that could cause sores. When to seek help. Call your doctor immediately if you notice any cuts that don't heal within a few days, signs of infection like redness, warmth, swelling, or discharge, or any changes in sensation in your feet. Don't try to treat serious foot problems yourself. Cutting your own corns or calluses, trying to remove ingrown toenails, or ignoring signs of infection can lead to serious complications. The bottom line: your feet are your foundation for independence. Daily foot care isn't vanity. It's essential health maintenance that can prevent serious complications and keep you mobile and active for years to come. Body Part 2. Genital and anal areas. The second critical area that requires daily attention is your genital and anal region. I know this topic can feel uncomfortable to discuss, but maintaining proper hygiene in these areas is absolutely essential for preventing infections, skin breakdown, and maintaining your dignity and comfort. As we age, several changes make these areas more vulnerable to problems. Hormonal changes, particularly in women after menopause, can cause the skin in the genital area to become thinner, drier, and more prone to irritation and infection. The natural balance of bacteria and pH levels in these areas can shift, making infections more likely. Mobility issues can make thorough cleaning more challenging. If you have arthritis, limited flexibility, or balance problems, reaching and cleaning these areas thoroughly may be difficult, but it's crucial for your health. Incontinence, whether occasional or frequent, creates additional challenges. Urine and fecal matter left on the skin can cause breakdown, infections, and painful rashes. Even small amounts of leakage that you might not notice immediately can cause problems over time. Certain medications can affect your body's natural protective mechanisms or cause side effects like increased risk of yeast infections or changes in bowel habits that affect cleanliness. For women. Daily washing. Clean the external genital area daily with warm water and a mild, unscented soap. Avoid douching or using harsh chemicals, which can disrupt the natural balance of bacteria and increase infection risk. Wash from front to back, from the pubic area toward the anal area, never the reverse. This prevents bacteria from the anal area from being introduced to the genital area, which can cause urinary tract infections. Pay attention to skin folds and creases where moisture and bacteria can accumulate. If you have excess skin or folds in the area, gently separate them and clean thoroughly. Drying. Pat the area dry with a clean towel, again working from front to back. Make sure the area is completely dry before putting on underwear. Moisture trapped against the skin can lead to fungal infections and skin breakdown. Underwear and clothing. Wear cotton underwear that breathes and change it daily, or more often if you experience any leakage. Avoid tight-fitting clothes that can trap moisture and create friction. Special considerations. If you experience any unusual discharge, odor, itching, or pain, see your healthcare provider promptly. These could be signs of infection that need treatment. For men. Daily washing. Clean the genital area daily with warm water and mild soap. If you're uncircumcised, Gently retract the foreskin and clean underneath, then return it to its normal position. Clean the entire area, including the scrotum and the area between the scrotum and thighs, where sweat and bacteria can accumulate. Drying. Dry the area thoroughly, including under the scrotum and in any skin folds. Trapped moisture can lead to fungal infections and unpleasant odors. For everyone, anal care. After bowel movements. Clean thoroughly after every bowel movement. If you use toilet paper alone, you may not be removing all fecal matter, which can cause irritation, odor, and infection risk. Consider using flushable wipes designed for adults, or install a bidet attachment on your toilet. These can provide much more thorough cleaning than toilet paper alone. Always wipe from front to back to avoid spreading bacteria from the anal area to the genital area. Daily washing. Even if you've cleaned after bowel movements during the day, wash the anal area thoroughly during your daily shower or bath. Use a washcloth or your hand with soap and water to remove any residue. Hemorrhoid care. If you have hemorrhoids, keep the area especially clean and dry. Use unscented, alcohol-free wipes and consider using a sitz bath for additional comfort and cleanliness. Incontinence management. If you experience any degree of incontinence, whether urinary or bowel, immediate cleaning is essential. Even small amounts of leakage can cause skin breakdown if left on the skin. Change protective undergarments immediately when soiled. Clean the skin thoroughly and apply a barrier cream if recommended by your healthcare provider. Consider using adult wipes specifically designed for incontinence care, which are often larger and more durable than regular wipes. When to seek help. Contact your healthcare provider if you experience persistent itching, unusual discharge, strong odors that don't resolve with proper hygiene, any sores or unusual growths, or signs of infection like redness, swelling, or pain. Don't be embarrassed to discuss these issues with your doctor. They've seen it all, and addressing problems early can prevent serious complications. Products to consider. Use pH-balanced, fragrance-free cleansers designed for sensitive areas. Avoid products with alcohol, which can be drying and irritating. Consider barrier creams if you're prone to irritation, but use them sparingly and as directed. The key message here is that proper hygiene in these areas isn't optional as we age. It's essential health care. These simple daily practices can prevent infections, maintain your comfort and dignity, and help you avoid serious complications that could impact your independence and quality of life. Body Part 3. Your mouth. The third critical area that demands daily attention is your mouth. Many people don't realize that oral health becomes increasingly important as we age, and poor oral hygiene can literally be a matter of life and death for older adults. Your mouth is the gateway to your body, and bacteria that accumulate in your mouth don't stay there. They can travel through your bloodstream and cause serious infections in other parts of your body, including your heart, lungs, and brain. As we age, several changes make our mouths more vulnerable to problems. Saliva production often decreases, either due to aging itself or as a side effect of medications. Saliva is crucial for washing away bacteria and food particles, so less saliva means more risk of tooth decay and gum disease. Many medications taken by older adults can cause dry mouth, increase the risk of gum overgrowth, or affect the balance of bacteria in the mouth. Some medications can also cause changes in taste, which might affect your nutrition and eating habits. Gum recession, which is common as we age, exposes the roots of teeth, making them more susceptible to decay. The roots of teeth don't have the hard enamel coating that protects the crown of the tooth. Physical limitations like arthritis, tremors, or reduced dexterity can make thorough brushing and flossing more challenging, leading to inadequate oral hygiene. Here's why oral hygiene is so critical for older adults. Pneumonia prevention. Poor oral hygiene is a major risk factor for aspiration pneumonia, especially in older adults. Bacteria from the mouth can be inhaled into the lungs, causing serious and potentially fatal pneumonia. This is particularly dangerous for people with swallowing difficulties or those who are bedridden. Heart disease. The bacteria that cause gum disease can enter the bloodstream and contribute to heart disease, stroke, and other cardiovascular problems. If you already have heart disease, poor oral health can make it worse. Diabetes management. Gum disease can make it harder to control blood sugar levels, and poorly controlled diabetes makes gum disease worse, creating a dangerous cycle. Nutrition. Dental pain, missing teeth, or ill-fitting dentures can make it difficult to eat nutritious foods, leading to malnutrition and its associated health problems. Quality of life. Dental problems can cause pain, affect speech, create embarrassing breath or appearance issues, and significantly impact your social interactions and overall quality of life. Your daily oral care routine. Brushing. Brush your teeth at least twice daily, ideally after meals, with fluoride toothpaste. Use a soft bristled toothbrush to avoid irritating your gums. If you have arthritis or limited dexterity, consider an electric toothbrush, which can be more effective and easier to use. Brush for at least 2 minutes, making sure to clean all surfaces of each tooth, the front, back, and chewing surfaces. Don't forget to brush your tongue, where bacteria can accumulate and cause bad breath. If you wear dentures, clean them thoroughly every day and clean your gums, tongue, and the roof of your mouth with a soft brush or washcloth. Flossing. Floss daily to remove plaque and food particles from between your teeth where your toothbrush can't reach. If traditional floss is difficult to use, try floss picks, water flossers, or interdental brushes. If you have bridges or dental work, you may need special flossing tools. Your dentist or dental hygienist can show you the best techniques. Rinsing. Use an antimicrobial or fluoride mouth rinse if recommended by your dentist. This can help reduce bacteria and strengthen your teeth. Avoid alcohol-based mouthwashes if you have dry mouth, as alcohol can make the dryness worse. Denture care. If you wear dentures, remove them every night and clean them thoroughly with denture cleanser. Soak them overnight in denture solution or water. Never use regular toothpaste on dentures, as it's too abrasive and can damage them. Make sure your dentures fit properly. Ill-fitting dentures can cause sores, make eating difficult, and affect your speech. See your dentist regularly for adjustments. Managing dry mouth. If you experience dry mouth, which is common in older adults, take extra steps to keep your mouth moist and clean. Sip water frequently throughout the day. Use sugar-free gum or lozenges to stimulate saliva production. Consider using artificial saliva products available at pharmacies. Avoid tobacco, alcohol, and caffeine, which can worsen dry mouth. Use a humidifier in your bedroom at night. Regular professional care. See your dentist regularly, typically every 6 months, or more often if you have gum disease or other oral health problems. Professional cleanings remove plaque and tartar that you can't remove at home. Don't skip dental appointments because of cost concerns. Many communities have low-cost dental clinics for seniors, and the cost of preventive care is far less than the cost of treating serious dental problems or the medical complications they can cause. Warning signs to watch for. Contact your dentist promptly if you experience persistent bad breath, bleeding gums, loose teeth, pain when chewing, white or red patches in your mouth, or any sores that don't heal within 2 weeks. Special considerations. If you're taking blood thinners, let your dentist know, as this can affect bleeding during dental procedures. If you have a history of heart problems, you may need antibiotics before certain dental procedures. If you're receiving cancer treatment, oral care becomes even more critical, as chemotherapy and radiation can increase your risk of mouth sores and infections. The bottom line: your mouth is not separate from the rest of your body. Taking care of your oral health is taking care of your overall health. Daily oral hygiene can prevent serious, life-threatening complications and help you maintain your quality of life as you age. These 3 areas, your feet, your genital and anal areas, and your mouth, may seem like basic hygiene, but they're actually critical health maintenance as we age. The changes that come with aging make these areas more vulnerable to serious complications, but with daily attention and proper care, you can prevent most problems and maintain your health, dignity, and independence. Remember, this isn't about perfection. It's about consistency. Daily care in these 3 areas can literally be life-saving. Don't let embarrassment or the feeling that these topics are too basic prevent you from taking them seriously. If you're struggling with any aspects of this daily care due to mobility issues, health conditions, or other challenges, don't hesitate to ask for help. Talk to your healthcare providers about adaptive tools, techniques, or assistance that can make these tasks easier. Your health and independence are worth the few extra minutes each day that proper care of these areas requires. You've earned the right to age with dignity and health, and these simple daily practices can help ensure that you do. If you found this information helpful, please share it with others who might benefit. Subscribe to Graceful Years for more honest, practical health information for your stage of life. Take care of yourself. You're worth it.